As the coronavirus continues its deadly march across the country, this warning for Americans.
Looking at what we're seeing now, I would say between 100 and 200,000 cases, deaths. I mean, we're going to have millions of cases, but I just don't think that we really need to make a projection when it's such a moving target. What we do know, Jake, is that we got a serious problem in New York. We have a serious problem in New Orleans, and we're going to be developing serious problems in other areas.
This after the CDC issued a late Saturday travel advisory for New York, New Jersey, and Connecticut residents, telling them to refrain from non-essential domestic travel for 2 weeks. The notice creating confusion after President Trump first weighed the possibility of a short-term quarantine in those states, but later backed away from the idea. Governors were given full discretion over the new rollout and said the advisory is already in practice.
It's totally consistent with everything we're doing.
That's something that, as I say, it's de facto happening already.
We're discouraging people from traveling and making sure they stay at home as much as possible.
With at least 59,000 positive cases and approximately 42% of coronavirus deaths in the U.S. centered in New York, Governor Andrew Cuomo extended the stay-at-home order through April 15th, stretching into major holidays like Easter and Passover. The state is trying to get ahead of the outbreak's peak, mobilizing a temporary hospital at this Manhattan Convention Center and awaiting the arrival of the U.S. naval ship that will provide extra beds for non-COVID-19 cases. And even more help is on the way. The president announcing that a flight arrived at JFK with millions of critical medical supplies for healthcare workers stretched thin. And after pressure from New York's governor, the governor of Rhode Island repealed the executive order that had police and National Guard members knocking on doors and checking cars for visiting New Yorkers, telling them they must self-quarantine for 14 days.
And Kathy joins us now live from the Javits Center here in Manhattan. Kathy, normally that's a convention center now being made into an emergency field hospital. When will that be ready to operate, and what's happening in Central Park?
Well, Kate, 1,000 beds have been added to the convention center behind me, turned temporary hospital. It should be ready to go come tomorrow. And you mentioned Central Park. There is another emergency field hospital that's currently in the works. We saw triage tents going up today, and those should be operational on Tuesday to treat COVID-19 patients.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.